I'll be evaluating pronation distortion syndrome and demonstrating the corrective exercise continuum to correct this impairment. So when evaluating an individual who may have pronation distortion syndrome, we want to look for if the feet are flat or turned out. We want to look for if there's internal rotation or valgus at the knee. Underactive muscles for pronation distortion syndrome will include anterior and posterior tibialis, the glute med and glute max, the vastus medialis, and hip external rotators. Overactive muscles for this impairment include the gastrocnemius and soleus, the peroneal muscles, bicep femoris, and the hip adductors. So, pronation distortion syndrome may be caused by compensations due to overuse or repetitive stress, naturally flat feet, or hip dysfunction. Inhibitory techniques are going to loosen the tissue and reduce muscular tension of the muscles that are overactive or tight using self-myofascial release. We don't have a foam roller, but this is just going to have to do for the sake of the video. We want to first inhibit the gastroc and soleus. So you can go ahead and lift yourself and then just use that foam roller. Next, we're going to inhibit the peroneals. Next muscle is the biceps femoris, so you can go ahead and lift. And just make sure you're getting that entire muscle. Finally, your TFL and IT band is usually tight with this complication, so we're just going to foam roll that out. Lengthening techniques will stretch and increase the range of motion in the shortened muscles, which are usually the same muscles that we addressed in the first phase, which is the inhibition phase. So we're going to go ahead and stretch out the gastrocnemius and soleus. Reach forward and just reach for 15 to 20 seconds. We also want to stretch the biceps femoris, so you can go ahead and lean forward and she'll feel the stretch in her hamstrings. For the TFL stretch, we're going to hold for 15 to 20 seconds. It's a standing stretch, so there's a little bit more pressure on the joints. Activation techniques individually target the underactive or weak muscles, and the muscles that we want to strengthen include the anterior and posterior tibialis and the glute medius and glute maximus. So for the anterior tibialis stretch or exercise, we're going to do resisted resistance band dorsiflexion. So she wants to focus on the eccentric action when her foot is being brought closer to her. And we're going to do that 15 times. Exercise that we're going to use to strengthen the posterior tibialis muscle is a single leg calf raise, and you can hold on to something for balance. I'm just going to lift one leg and do calf raises. We're going to do 15 of them. An exercise we'll use to strengthen the glute medius are side-lying hip adductions. So we're going to lie on our side and abduct our leg to about 45 degrees, and we're going to do that for 15 repetitions. Exercise we'll use to strengthen the gluteus maximus are glute bridges. So we're just going to lie supine and use our hip flexors to lift our body, and then just make sure we're contracting our gluteus maximus. And we're going to do that for 15 repetitions. You can go ahead. Finally, our integration techniques are going to improve our patient's balance, total body coordination, and total body movement. So we're going to start by doing an exercise sort of similar to the STAR excursion balance test, and we're going to use multiplanar motion with sort of strengthening the stance leg. So you can go ahead and lift one of your legs, and then make sure your stance leg is slightly bent, and use balance to reach in front of you, on the side of you, and behind you. And make sure that the knee and foot are neutral. And then we're just going to do that 15 times for each direction.